Attention please. This uploading is only for educational purpose. No intention to infringe copyrights. Learning English with subtitles. GPITRAL. Follow us.
Today on The Real A&E. Doctors fear serious injuries for schoolboy Adam when a play fight goes badly wrong.
The worst case scenario with this kid would be that he's got a spinal cord injury with paralysis.
Darren hurts all over after falling into a pub cellar.
I was in a state of shock because I saw the size of the gash on my leg and it was just like...
It was like a 50-50 challenge.
And a heavy tackle could be the final whistle for a talented teenage footballer. These are real people with real emergencies in the real A&E.
The Real A&E, Episode 9. Short clips showing action include a man being retrieved from under a truck, the air ambulance flying to an emergency. In hospital, a biker is carefully lifted from a stretcher. A surgeon is shown at work in the operating room.
An emergency call is coming in to the air ambulance base at Teesside.
Just on the school field? OK, darling. South side of the school field.
A 12-year-old boy has been seriously hurt on a school playing field. The school is one of 3 in the area, but first the team have got to find it.
They spot the school playing fields ahead of them.
It looks like it's this school coming up on the nose. On the nose. There is schools beyond it. Yeah. 1, 2, 3 schools in this vicinity. Sorry guys, but I don't see anyone. No, you don't. Oh, hang on. That's not them down there, is it? I think... Got it.
Once they've located the school, pilot GPITRAL lands as close as he can to the accident scene.
Found it then, have we? Yeah, just there on the corner. Yeah, got it.
They land on a sports pitch near the school building.
Cheers, Chris. No worries.
The boy lies on the ground nearby.
12-year-old Adam was having a play fight with another pupil. Adam was being held in a headlock and was wrestled to the ground. He felt something click and now he can't move his neck and has been left in agonising pain.
Adam, hi Adam, I'm Tim, I'm one of the doctors. Whereabouts is the pain at the moment? Is it where you've got your hand?
It's my neck and my shoulder, but there's a pain in my right leg.
Your left arm, which is behind your head, can you move it at all? Don't if it hurts. Okay. Any pain when I'm pressing there?
Yeah.
Yeah.
Okay, so central tendon. Okay. Can you just squeeze my finger nice and tight? Does that feel normal to you? Okay. And can you just wiggle your toes on this foot for me, Adam?
Can't.
Okay, try moving your foot on this left side for me.
Good.
That's it, good man.
Done.
Try and get a little bit more on this side for me.
On your right.
Just try and lift your toes up. Okay, all right, let's get the collar on and get him immobilised.
Worryingly, Adam is unable to move or feel the doctor touching his right foot.
Is that all just pain in your neck, is it? Okay, good man.
He's also complaining of pain in his neck. This could be due to a crack in his spine. It's vital that Adam isn't moved any more than is necessary.
This is just keep your head still, all right?
Just gently, yeah, that's lovely. Just to make sure your head doesn't roll around when we're in the aircraft, okay?
Collar and blocks and a scoop stretcher will help keep him in position.
This little drip in the back of your hand here, okay? I'm just going to give you a bit of medicine through there. It might make you feel a little bit woozy, but it will help to take the pain away. 1, 2, 3.
He's lifted on the scoop stretcher and carried to the helicopter.
Spinal injuries can lead to paralysis. Hopefully that won't be the case with Adam, but the doctor is taking no chances.
Fab.
Okay, you'll be fine.
He's been securely strapped in.
At the James Cook University Hospital in Middlesbrough, 33-year-old fitter's mate Darren Jones has fallen down a hole in the pavement into a pub cellar.
I was in a state of shock because I saw the size of the gash on my leg and it was just like...
The blood just won't stop pouring out of it. Is that bad?
I don't know if it's an artery or not. You live at the artery, couldn't it?
A&E Dr. Khan is on his way to see Darren.
Oh, sir, I'm Dr. Khan, one of the doctors here. I gathered you have some fall today.
Darren was going from the pub to the hole-in-the-wall cash machine and didn't see the opening in the pavement.
Jogged along the street, fell down the cellar, which was wide open on the street, cracked my head. I was holding my leg, I was gushing out with blood.
Let me see your leg. Where are you feeling pain right now?
From there to there.
Darren's been drinking and thinks he was knocked unconscious when he fell. Besides his leg, Darren's hurt his head and hands too.
Yeah.
But it's his leg that's the biggest problem.
Hello there, I'm Richard, I'm one of the senior doctors.
With the help of A&E consultant Dr. Richard Johnson, Dr. Khan wants to take a closer look at the wound.
Just lift your leg up slightly for me. There we go.
This is the first time Darren's had a clear view of his lacerated leg.
They put me to sleep.
It's a very deep cut and needs careful examination. But first, Dr. Johnson injects a local anaesthetic to dull Darren's pain.
No, you're doing really well.
You're doing very well. You're a brave lad.
Dr. Richard Johnson.
It's the structures underneath the skin that I'm interested in looking at, because in that area there's a tendon and there's muscle that we need to make sure that if that has been disrupted, if we're stitching it up, we put it back in its anatomical position so it'll heal properly.
But after taking a good look, Dr. Johnson has bad news for Darren.
I can see basically the bone of your leg at the bottom of the wound. So that makes me worry slightly that you'll have damaged one of the tendons at the front of your leg. Okay, so I think what we may need to do before we stitch it up.
Darren's injuries may be more serious than he feared. The X-ray results will tell.
You're done.
12-year-old schoolboy Adam is being loaded onto the helicopter after a play fight with friends went wrong. He's got agonising pain in his neck and has trouble moving or feeling his right foot.
You've got a 2-year-old male patient. Patient's been involved in a tussle with another student. Patient has C-spine tenderness with paresthesia to one of his lower limbs.
Your mum will be there when you get there.
Okay.
Right?
We'll take good care of you.
The helicopter prepares to lift off.
It'll take just 10 minutes to fly to the James Cook University Hospital. A&E doctors have been alerted to Adam's imminent arrival.
The worst case scenario with this kid would be that he's got a spinal cord injury with paralysis. If it's high enough, then you can paralyse the muscles that make you breathe, and it's potentially fatal.
The air ambulance team hand over to Dr. Johnson.
So this is Adam. He's 12-year-old, been at school, had somebody give him a headlock, brought him down to the ground, felt severe pain in the side of his neck, the back of his neck and his left shoulder.
The doctor is concerned about Adam's inability to move and feel sensation in his right leg and carries out some important checks.
Yeah? Can you feel me touching you there?
Yeah.
When anybody either has the inability to move a limb or can't feel me touching their limb, then that can be suggestive that there's a spinal cord injury. Can you feel me touching you there?
Yeah.
Can you feel me touching you there?
Yeah.
Good lad. Adam said initially at the time of the injury that he couldn't feel his leg, but now when I've examined him, he's got normal sensation and what we call normal power, i.e. he's able to move his leg completely.
Ready, steady, roll.
Adam may have regained the feeling in his leg, but the doctor is still concerned about the amount of tenderness in his spine.
That was a yes then, yeah?
Yeah.
Okay, does that hurt?
Yes.
In children, certainly, it's possible to injure your neck and have normal x-rays. So it's important that we look more deeply. Normally we'd go for a CT scan, but the consultant radiologist thinks that an MRI scan would actually be better in this case.
Having a scan is a scary prospect for a 12-year-old boy. Adam's mum, Melanie, goes with him to hold his hand.
A nurse wheels Adam to the scanner waiting area.
Still in another part of A&E, 33-year-old fitter's mate Darren Jones has just had an X-ray on his lacerated leg. It's good news. The bones are not broken.
Hello, Mr. Darren. How are you, sir? How are you feeling now?
Sickly.
So good news is that you don't have any funny fracture. So what most likely you have is muscle injury or soft tissue injury, okay?
Although Darren's bones are not broken, the cut is deep and bleeding profusely. He's taken back to the minor injuries theatre to be treated by A&E Dr. Khan.
Just lay nice and still and nice and flat, okay?
To help him cope with the pain, Darren gets gas and air. It's also known as laughing gas, and it makes Darren giggly.
Chop it off.
Keep nice and
still. Good.
Dr. Khan cleans the wound.
Good job. Good.
In pain and panic, Darren begins to gulp the gas and air too fast.
Slow, deep breaths.
Just water to clean it. Nothing else. There's no need. Okay, don't worry. Just water.
What says that?
There's no need. There's no need. Don't look.
Oh, all right. Don't show me.
But Darren is afraid of what might be going to happen, and he's gulping again. Suddenly, he goes abnormally still.
You okay? Darren?
Darren, are you okay?
Darren, speak.
This is a worrying development.
Okay?
Darren is completely unresponsive.
Subtitle reads, "Call Richard."
Dr. Khan needs advice and sends for his senior colleague.
Hello, Darren. Are you okay? Are you okay, sir?
Coming up. Teenage footballer Ollie fears his dreams of being a professional goalie have been shattered by his broken leg.
I gutted really. My footy and stuff. Won't get a play on it.
Hello.
And Darren snaps back into reality after gulping too much gas and air.
You're taking too much oxygen. Good.
End of part 1.